I mean, that's a tough question.
That is a tough question, and I wish there was an easy answer for it. And you know, just because of the position I've been in the last several years, I get the opportunity very frequently, especially towards the end of a school year, as students are getting ready to graduate, and they're getting these offers, and they're coming forward with these these contracts. They bring them to me, and I help just think them through the process. And I've told students to go work for DSOs. I've told students to go work corporate. I've told students to go private practice. I mean, it's so dependent on what they have in front of them, and it all comes down to what do they want to get out of it. Do they just want a paycheck? Well, it doesn't matter what you do. Find the one that gives you the best paycheck. But if they want to, if they want to grow and develop, maybe someone that's going to offer some mentoring and some coaching and some teaching, that's going to be more beneficial.
All right, we're back. Still in Belize. Dr. Steve Call and I are just sharing a Coke and a smile. I'm going to call this the Baller Series because we're bringing out the big ballers in education. So Dr. Steve Call, he is the newly appointed Clinical Dean of Midwestern University College of Dental Medicine.
Yep.
Congratulations, Glendale campus.
Thank you.
He's also my mentor, my first mentor. So it's Steve has probably the hardest job ever of trying to teach me anything, and then trying to make me productive and not a questionable member of society, right?
It had its challenges. No.
We had a lot of fun.
It was a good time.
We had a lot of fun, and we're still having fun. And so we're really lucky because Steve's gotten involved now with Elevation Association and gives us a lot of good feedback. He comes from both. He was a general dentist before he went into education. He practiced throughout a couple of practices. He owned a couple of practices, and he went to practice in Cottonwood, Arizona, and then he owned one in Surprise, Arizona. Yeah. So just some really cool experience he had, and he's actually a fabulous practitioner. We got Nelson in the background. Yeah. He's just going to come and serve us some more Cokes. So we're keeping it light, with this stuff, but we're going to talk about some serious stuff, maybe some not so serious stuff, and get his take on it because he's been in education for 14 years
12 years full-time. It was part-time for 2 years before that.
Yeah, so 14 total years.
Yeah.
His story is really cool. He kind of transitioned into... found that he loved education, and the way that Midwestern does their the format of education is a little different. So we were paired up into a suite, and in that suite we're paired up with our partner, and then you had a clinical care coordinator, or what we call a CCC, and Steve was one of those, and so he basically oversaw our group of misfit toys that were trying to become dentists, and it turned us into real people and real dentists. And I can probably say that at one point in my life, he taught me everything I knew about dentistry, right? So
for about 5 minutes.
Yeah. But he comes with a host and wealth of knowledge and experience, and we just appreciate the crap out of him and his wife Robin, who's a practicing dentist as well. So a lot of what he has experience is not just from the education perspective, but they're in the trenches still. I mean, he's not practicing with her practice, but he feels the pains of what happens in the real world. So a lot of cool stuff. It also gives him a unique take on trends and where things are moving. He's got just a whole lot of resources available to him to bring to the table, and so we'll tap into that knowledge and experience a little bit.
I also have a son who's a fourth-year dental student, so
right.
I get that side. I mean, his side of the education as well, and then a daughter who's got about 2 more years of undergrad who's thinking about dental school. So
You're getting it from all sides.
very vested in the process,
right?
from start to finish. Yep, for sure.
One thing we won't talk about is how much school he came out of debt with. When I found that out, I threw up a little bit in my mouth, and I was insulted somehow for like about a year. So let's just again, congratulations on the new position. I think that's a fantastic move. So, Dr. Geppinger, if you're listening, that was a smart move to put him into a dean role. Tell me a little bit about the position, what you want to do with it. How's it going to look under Dr. Steve Call? How is this going to be?
So basically the official title is Associate Dean of Clinical Education. And the way our school is set up, we don't really have departments. I mean, we have kind of 2 areas. We have the first 2 years, which are preclinical, second 2 years are clinical. So I'm basically responsible for the second 2 years, the 3rd and 4th year of the dental students' education, making sure they get the experiences they need, making sure the clinic operations are all intact to be able to efficiently deliver those experiences, to make sure students get a well-rounded clinical experience. That goes from, making sure the staff to support the processes are in place, the faculty are all calibrated and working towards the same goals and teaching in similar manners, the same procedures. And with 145 students in a class, that can be challenging at times. But I think we've done pretty good. Our students get a ton of experience, and I think they're very well prepared to enter what we hope is private practice. That's kind of our goal, is to develop competent and confident general dentists ready for the private practice, so we'll have a competitive advantage to be able to get those primo positions out in the real world. We understand cost of education is big. I mean, how else can you say it? It's a lot. It's
heavy.
It's expensive to get a dental education. And we take our responsibility to prepare our students to be able to meet those challenges very seriously. That's at the foundation of everything we do. And so that's kind of, as the Associate Dean of Clinical Education, that's my job, is to make sure that all of our students are prepared to meet those challenges once they graduate.
So hit the ground running, and that's the design. So there's a couple unique things about your clinic. Compared, I'm not saying I'm not going to say it's better or worse. It's better, but it's
unique.
It's unique, right? Yeah. So, and it's unique in the sense that is one of the, and this isn't. Your dental school may be different and be a better fit or whatever, but that's not what I'm trying to say. Is that at Midwestern, it's built into it, and we did an interview with Dr. Smith where he talked about this as well. It's built in that when someone graduates from the dental program, they should be able to tackle that debt, start to work, have the skill set and the ability to work, hit the ground running, make some production from the get-go, so that they can start to tackle the debt, and not just, it's not just, we'll take your money, educate you, and wash your hands of you, and it's more of a like, hey, let's get you ready. It's in our design. So what are some other unique things about, I mean, I know what they are, because I went there. What are some other unique things about Midwestern's approach on clinical training?
I think one of the key things that distinguishes us from a lot of different other programs is in our clinical years, the 3rd and 4th year, all of our faculty come from private practice. So they know what it takes to be a successful private practitioner. Mm-hmm. And so everything we do, we're always looking at, how would we do this in practice? How can we take what we would do in practice, and morph it to work in an educational environment, where we can still have the efficiency and the productivity. And it's all about getting the students the experiences, getting them the repetitions. We're incredibly fortunate in our geographic location. We're like 5 miles away from the largest retirement community in the country. And so we have what seems like an endless supply of patients who are willing to come and get our services. And so that really helps our students get just a huge amount of experience. They're in clinic 4.5 days a week. They're 3rd and 4th year. We do partner, so theoretically half the time.
Yeah, talk about that partnership.
Yeah, so we partner a 3rd and a 4th year together. They each have their own family of patients. I'd say between 80 and 120 patients that they're responsible for, everything from, initial diagnosis, treatment planning, carrying out that initial phase of treatment, to recare and follow up forever. We don't dismiss patients once they're done with their treatment plan. We keep them as part of our recare program.
And I think an unintended, or maybe intended, it's probably intended, but I think one of the benefits of that is that I was an assistant for 2 years, the world's worst assistant, but I was an assistant for 2 years and learned about how I got a new appreciation for assistants. And so when I'm going and I have these assistants working for me, and I can still commiserate with them and be like, yeah, when I was assisting, this was frustrating. Or if I'm training a new assistant, I can say, when I was assisting, I had the same problem, and it really gives you a level of compassion and relatability that I don't think you would get otherwise, right?
Yeah, absolutely. You've kind of been there, done that. You know what it's like to have a really good assistant and what it's like to not have such a good assistant. I think it just makes you more prepared to train your own assistants. I mean, even if you bring in an experienced assistant to your practice, there's an adjustment period where they get used to you and learn how to anticipate what you do and what you want. So I think it just gives you a good perspective with all that. Another nice thing about that partnering, you kind of have as a new third year coming into clinic, you have a built-in mentor that isn't a faculty member. Sometimes, when you first get into clinic, you're kind of intimidated. There's a lot going on. You have a patient with feelings in front of you instead of a mannequin head that you've been working on for 2 years, and
feelings.
They have a tongue and a saliva and all that fun stuff. It just having someone there who's a colleague, but a little further down the road than you, is a hugely calming influence. And they can kind of like quietly guide you and, direct you without having to always run to the instructor. Obviously, our faculty,
obviously.
We have a really good faculty to student ratio. In clinic, it's about 5-1, pre-clinic as well. So there's always faculty available, and they're definitely overseeing everything. But sometimes you're like, I don't know if I should do this or this, and you can just ask your partner, and partner's like, yeah, go ahead, just do that, or maybe let's hold off, let's talk to the doc and see what they say. So it's just it builds in a little bit of a safety net, which is really, it helps our students get confidence quicker, I think.
The other thing that I know about Midwestern, the clinical, is that it's a drive towards digital dentistry. That's obviously the future.
Yep.
That's the gold standard now. If you're not doing it, invest in it. Oh my gosh, do digital dentistry. So what are you guys using in the clinic? What digital things are you guys doing right now? And what are the challenges that come with teaching that? Because there's a paradigm shift that comes with it, right?
Yeah, there absolutely is. So we do digital impressions, design, mill, that whole process, start to finish for fixed prosthodontics. And then we also are doing digital dentures. We're not
What the heck does that mean?
So basically we're not scanning in the mouth for our impression. We're still taking a conventional impression, but then we scan that and use software to do the setup. We do a virtual setup. You can kind of print out your try-in.
So you're
printing your bite record, your record bases, you're printing your try-ins. You can even print a test denture if you want. And then for our final denture, once we have everything dialed in, we'll mill them out of the acrylic pucks.
Well, I can say this, that we have one of our guests. That this is our Legacy Summit 2022, and one of our guests who's also graduated. He's been graduated for about 2 years. I won't drop his name because I haven't asked him yet, but he got enough experience that he's doing that now in his office to the point where he bought a printer and he bought a scanner, and he's doing digital dentistry or digital dentures in his office currently.
The really cool thing about them, other than the ability to quickly make tweaks and adjustments to the setup, the huge issue we always run into with conventional denture technique is that polymerization shrinkage, right? And that affects the fit.
Right.
And so you're relining or, putting in a soft line or tissue conditioner, something like that, to just try to get the denture to stay put.
Yep.
With this, we eliminate that step. The final denture that's milled, the block is pre-cured. It's already hard, so they just mill out the final shape, and you can control the thickness, so you have a uniform thickness of acrylic everywhere, and patients absolutely love the feel of them. And once we give them to them, even if they're not exactly perfect, they don't want to give them back. I'm like, let's just fix this.
Right.
No, I don't want to leave it. They love it. So that's been the huge advantage. And we kind of knew that was an advantage going in, but we didn't realize how much the patients would really love it.
And so for a guy like me who hates removable, this is a huge advancement in making life easier.
Yeah.
You combine that now with implants, and it's really becoming a game changer on what's happening. So, but you guys are also, when I was there, we were doing single unit, CAD cam. So we were milling out stuff. I have a restoration in my mouth today that we milled out. You and I did it with Dr. Smith, and I was a guinea pig, and it was fun, and it's still there. So it was an EMAX, but that's something that's still happening as well.
Yeah, we do. That's our bread and butter. We do a lot of single unit. We could do multiple unit. And we'll even do some, some fixed partial dentures, some bridges. But I would say 50% of the crowns we do are completely digital. We're not using impression material at all. And probably 50 or 60% of those are done in a single visit, which with a pre-doctoral dental student, that's saying something.
Yeah.
And it starts, it's not just what we do in clinic. It starts first year. They start getting real familiar with the scanning, with the software. They use it to analyze their preparations, blow things up really big. Again, I kind of see it, and that carries into clinic. And you kind of asked about the challenges of that. One of our challenges was getting our faculty up to speed. Not all our faculty did digital dentistry. When we integrated digital scanning and impressions as soon as our clinic opened in 2010. At that time, it was out there, but it wasn't common. I'd say maybe 10-20% of practices.
It wasn't as good as it is today. That's for sure.
Not even close. But and so that was our challenge, was getting the faculty and we kind of have to take our hat off to the students, because they're the ones that really pushed our faculty to do it. They jumped on board with the technology. They ended up teaching a lot of our faculty how to do it. Now we're at the point, we've been doing it for 10, 12 years. Most of our faculty are very comfortable with it. But the students were really the ones that drove that. There was a few of us, like I've been using CAD CAM in my office since 2001.
You're a Zurich guy from the get-go, right?
Yep. So early adapter of that. And I fully believe in the technology. My patients loved it, and the convenience, everything was just awesome.
You were an OG you were a red cammer, right?
Yeah, the old red
originally,
cam.
And then you went to blue cam.
The first CEREC 3 software. When the CEREC 3 came out, that's when I jumped on board. Yep. And then they made the conversion to 3D and everything like that. And red cam, blue cam, OmniCam, and then now they're at the Prime Scan. But the cool thing now is there are a lot of different systems out there that all work.
We use E4D in school.
Yeah, and we still use E4D. It's the nice thing too is you learn one system with like 15 minutes you can pick up another system.
No doubt.
You just got to learn where the tools are and what they're called.
Yeah, it's just driving. Learn how to
drive the car.
Yeah, that's right.
Yep.
Where's the ignition switch and how you make it go? Yeah. So and we're not. In our office, we've got a couple different systems, and I found that to be true, is that you just have to kind of learn the language of what everyone that's doing. So that's pretty rad. You could, for me, when I went into residency, I was one of the only ones that understood how to use, because I went from E4D to Zurich, and that was an easy transition. And I was, for a hot minute, I was the only guy that understood how to use it, and so it was cool to be able to. Well, we had a couple other guys from Midwestern that were in my residency program that understood it, but it was cool. What are some of the trends that you're seeing in dental education right now? What's happening? What direction is it going?
There definitely is the push. Those are the two big fronts that we've kind of hit on a little bit with the digital dentistry and the implant dentistry. That's really changed the face of dentistry. I think it's given us a lot more options, a lot more things we can go to help solve the issues that our patients come in with, and those are something we've embraced wholeheartedly. Our students get the opportunity to place implants, restore implants. We do a completely digital guided workflow. help them determine, case selection, which ones they're fine to try in their own private practice, and other ones that they might consider referring out. And
Also, the gold standard in dentistry now is guided.
yeah,
Yep.
no,
Part
it's,
of
so
digital.
it's and we, it's been very successful. We've found our success rates to be comparable with those of practicing dentists. So even with students doing the surgery, it's been cool. And I think it's taken some of the mystique out of it. It's all about the plan. If you have a good plan and know how to execute the plan, it's pretty predictable, and that's been really good. But I think a lot of schools are trying to incorporate those disciplines into their curriculum, with the digital CAD/CAM dentistry and implant dentistry. And what we're doing it's nothing secret. We share it with schools all the time, and every program has their strengths, has their challenges, and we're no exception. I think we're the best, but that's just 'cause I work there. But
Now you're the boss of it.
yeah, I kind of have to. But no, we go to other schools too, and we
because you test at other schools.
I'm an examiner for ADEX, and so I see lots of different schools, and I talk with their faculty and their try to glean from them what works for them, because we all kind of face the same challenges. And I think the more open we are with each other, and it's just going to produce collaboration that's going to elevate education across the country. And that's honestly, that's what got me into education out of private practice to begin with. Is I saw what Midwestern was trying to do, and it was different than the education I experienced. And I think I got a great education. But I wanted to be part of something that was going to kind of change how education takes place.
Groundbreaking. Right?
Yeah, I learned how to do dentistry in dental school, but I didn't learn how to be a dentist. Mm-hmm. And there's a difference.
Right.
There's the technical aspect, and there's the whole package. And we really try from day one to just we're teaching the whole package, and we want you to, like we said before, hit the ground running and be able to help your patients and meet the obligations and the responsibilities that you have.
That's one of the things that you taught me that it still sticks with me, is that you can be a good technician and a crappy clinician, and you were always big on, like, I want you guys to be good clinicians and be able to diagnose and recognize and treat the patient, the whole person, and understand as a human being, and that's an approach that, like I say, I think about it all the time. You brought up ADEX. Let's talk about that a little bit, because that's been a change from when I was in dental school,
Absolutely.
which was not that long ago, 10 years ago. So what's going on there?
So basically, I think when most of us went to dental school, we had our pick of regional boards that we wanted to take, right, depending on where we wanted to practice. We had REB and NERB and CETA and ADEX, all these different testing agencies, and they were all kind of geographically positioned for whatever part of the country you're going to be in. Over the last, it's really changed in the last 3-4 years, and kind of culminated this year. There's been a push for a national licensing exam, practical exam. The ADA's pushing an OSCE type exam. They've changed how they do national boards. It no longer is a part 1, part 2. It's now an integrated board that you take during your 4th year. The theory behind it is the average practicing dentist would be able to pass this test without really studying too much. Our students have been very successful because that was what we designed our curriculum around from the beginning with. So we really didn't have to change anything. Our students were like, "Aren't you going to give us a prep course?" I'm like, "That's what we've been doing for 3.5 years. You're fine." And our results have shown it. Our students have been incredibly successful with that exam. But then with the licensing, last year, CDCA is the testing agency that typically administers the ADEX exam. Last year, we joined forces with REB, which was another major player. They kind of basically had most of the country west of the Mississippi.
Western Regional Exam Board.
Yeah, Western Regional Exam Board. So we merged last year, the CDCA kind of merged together with REB. And then this year, CETA, which I can't remember exactly what the acronym stands for, but it's kind of the southeast region of the United States. They're on board with the CDCA now as well. So we truly have a national exam. It's good in every state except for New York, which New York doesn't require a national or a regional exam because they have all their new dentists do a PGY1 or 2 program, residency program of some sort in order to get licensed.
Is that the trend? Do you see that happening? I know that so I did do a residency, I did an AGD through the Air Force. Is that the trend? Is that going to become mandatory for general dentists to do a residency?
I hope not.
You hope not.
I hope not.
Why do you?
Well,
hope
I mean,
not?
I'm not anti PGY1s, but I think our students have proven, or our program has proven, that it's not a necessity to be a good, competent clinician. And again, I'm not. I think if it's the right scenario, it makes all the sense in the world to do a residency. If that's it just depends on what you want to do in your career. But if it's just, I think what it is a way to give, new grads a little more experience before you just release them on the public, just to bring up that competency level a bit. So in a way, it sort of eases the pressure and takes a little bit of the responsibility off the dental school, because a lot of schools have a hard time drawing enough patients to give their students a sufficient amount of experience to be able to just hit the ground running.
Right.
And again, because of our geographic location and our patient pool that we don't have that issue, which is a huge blessing to us, because we can provide those experiences for our students, and they can get enough experience to where they kind of know the basics by the time they get out. They're not super intimidated. They've done enough procedures, enough repetitions that kind of basic dentistry they're pretty good at by the time they get out of school. So, but I there is kind of a push.
So you're not against residency. You just don't want to make it.
I don't want to make it mandatory.
Right.
I think just how it's been traditionally. If you feel you have the need, and there are students even at our school, they'll come and say, "I'm thinking about doing a GPR or an AGD," and I'm like, knowing the student, I'm like, that'd probably be a good idea. And it's not necessarily that they haven't gotten the amount of experiences. It's just some students develop and mature at a different rate, and that extra year to build a little more confidence, get a little more experience, helps them a lot. And so, but there's also students who, are chomping at the bit and they want to get out there, and they'll do all right because they know they've picked it up and developed that competence and confidence to go out and hit the ground running.
So for me, I loved my residency. It's a love-hate relationship, honestly. But big shout out to Colonel McClure and Colonel Gamble. They were my residency directors. Love those guys. But they, for me, it was something that when you go into the military, they kind of promote you to do it, right? And so I kind of went into it going, sure, why not? But I don't regret any of it. It's tough, I won't sugarcoat it, but I can definitely see where, it's interesting because if there's been such a shift that there for a while I was wondering, I was like, are they going to do a mandatory residency program? Are they going to move dental school to 5 years? Is it? But if there's been this shift, and it's been cool because we got in on the ground level in a sense, and that we were the first guinea pigs for this new direction in teaching and education, and so it was really cool to be a part of that and now to sit back and kind of see how it's evolved. And I've got friends that are multi-year graduates of Midwestern, and talking to you guys and seeing how it's evolving and the effect that it's having, because it's bleeding out into other schools now that are seeing that, hey, this is an effective way to get our students ready for the real world, and ultimately that's what it's about, right? So that's pretty rad. Are there any trends that you're seeing in dentistry period that you're like, that's not so good, like anything that's concerning or that maybe is a little eye-opening?
Let me state it by, rather than say what I don't like, let me say what I would love to see our university accomplish, and you can kind of read between the lines.
All right.
Because again, I'm not here to bash on any method of practice or any organizational structure.
Sure, different strokes for different folks.
And some work for some and some work for others. What I would love to try to incorporate over the next decade or so is a network of private practitioners who know how to treat an associate and know how to mentor an associate and know how to teach them sound business practices, sound, practice ethics, how to take care of patients. Because I firmly believe if you take care of people, they'll take care of you.
Yeah.
But you still need to know, I mean, especially with as much competition as out there in the world, you need to know some sound business principles as well. And you need to work not only in your practice, but you need to work on your practice.
Yeah.
And you need to steer that boat, right? Let's see how many cliches I can use.
Yeah, I can't talk without
that. That's what I'd love to develop, just a huge network of practices that can bring an associate in. And it's not even necessarily for a chance to buy into the practice or anything like that. Maybe that's there, maybe it's not. But if they could take an associate for a year or 2 years and kind of create like a private practice residency almost. That's what I would love. I'd love to be able to place every one of our graduates into an office like that. And then at the end of that, then they decide, okay, now what do I want to do? Do I want to do my own practice, or do I like just being an associate? Some people don't want to be an owner, and that's okay. But I think starting off that way, you can kind of see that you can be successful and you can take care of people in a way where you can be proud of. And again, I don't want to bash on other business models, things like that, because I think you can be ethical and honest in any organizational structure. But I think, with the private practice where the owners are there and they're part of it, they're doing the dentistry, or at least, very much involved in the process. I think that, to me, that's how I'd want to start out my career. I was one of those crazy people that bought a practice right out of school. I'm like, how hard can it be? I learned out how hard it can be.
It can be hard.
And it took a few years where I was drowning in. And luckily, I got partnered with some good consulting people that really helped me understand the business side of dentistry. And that's what shaped my career. And it still shapes how I think today. I think like a private practice owner, and that's how I that everything we do at the school, I think we all kind of are wired to think that way and say, how can we make this work here at the school?
Yeah. And I'm a big believer, I mean, you touched on it, we're big believers in having a coach or a mentor, right? So whoever that is, if that's, if you're an associate, have a good mentor. I mean, I have, probably 5 different coaches and mentors that I still rely on today, including you, to hear and pick and have the conversation. And, and that what's cool about mentorship is that I don't think it's designed to just be, you're going to teach me and I'm just the student, and you're, what I mean? It's a symbiotic relationship that you can grow, and as you're teaching someone, I found that like you gotta be on your game, like, and so I find myself like digging into the old textbooks.
You want to really learn something, teach it.
Yeah, right. That's right.
Exactly it.
Yeah. So I think it's valuable, and I think that's super sage advice. What advice, Dr. Brad Smith and I had a chance to talk quite a bit about this. I'm not going to get too much into it because it's not really your jam to get students into this school. You're more concerned about getting them out and graduating them. So, but what advice would you give to a prospective dental student, someone that's doing their undergrad, and their neighbor has a boat and it's a dentist, and so they're pretty sure that that's what they want to do. And so they're going to hit, and not that I joke about that, but kind of not joking, right? So, what advice do you have for the prospective dental student?
Get into dentistry. I mean, just spend time in practices. If you can get a job at a dental lab, do it. Even if you're just sweeping the floors, pouring up impressions, whatever it is, do it.
Why?
Because the more exposure you have, the more you'll understand. That you're just building the foundation brick by brick by brick.
Okay.
Right? And as sooner you can do that, when you get to dental school, if you have some of those key foundational pieces already in place, you're already on to the next level of the building. You're going. I'd say that students looking at, we've had 110 to 145 students the last 12 years graduate out of Midwestern. The ones who have been super successful, they all had previous life experience, meaning they didn't just, and you can still do it if you do this route, but they didn't just go to school and then go to dental school and go to college, go to dental school, and then they worked some. You had a business before you came to dental school.
Yep.
They just had, and I think it just gives you a different perspective, so that as you learn the dentistry, you kind of put it into proper perspective, proper place.
That's interesting because that's the exact same thing that Brad said. So Dr. Smith was big thing. He said, "Hey, get some life experience.
Absolutely.
Get your hands dirty."
There's no rush to get into dental school. Now, my wife went to dental school a little later in life when our fourth child got into kindergarten. That's kind of when she started her dental school career. And that does bring its own challenges to starting later, but you don't need to be 25-year-old and be done with dental school. Like, take a few years and do something.
Not everybody has to be a duty houser.
No, exactly. Get some experience, whether it's, even if it's something like go do some time in the military or get a job somewhere, whatever it is. Dentistry helps. If you're in dentistry, that definitely gives you a different leg up, a strong leg up. But it doesn't have to be dentistry. I mean, you did landscaping, right?
Mm-hmm. Yeah,
But just learning, just learning how to deal with people and manage people and customer service, all those things, they all help when it comes to treating patients. Because at the end of the day, we're taking care of people. And if you know how to take care of people coming into dental school, you'll be absolutely fine coming out of dental school.
What would you say to the student that's chasing the income?
There's easier ways to make money. Every day I think, wow, why did I do dentistry? I hear about some guy who made bazillions of dollars on Bitcoin or something like that. I'm like, there's easier ways to make money than dentistry. Dentistry is a phenomenal career, and I love it. Obviously, I'm a dentist. My wife's a dentist. I have 2 kids going into dentistry. I think it's the best career out there, but it's not just about the money. It provides a comfortable living, absolutely. And it has the potential to take care of you, and that's great. With the investment that you put into it, it should have that, not only in money but in time. I mean, you have 4 years of undergrad, at least 4 years of dental school, and then if you do residency or whatever, that's additional training and time. It's an investment. It's a commitment. So it should pay a dividend or a return on that. But there's easier ways to make money if you're just doing it for the money.
So having said that, what are the biggest challenges that you see for new grads? Like, what do you see them facing now that maybe was different than when you were in dental school or coming out of dental school? What are the biggest challenges that are facing new graduates? And not only that, but what do you think the way to deal with them would be?
I think one of the biggest challenges that new grads face is the debt. I mean. I think when I went to school, the average student was graduating with about $100,000 in loans, which is about what I had. Now it's over $500,000, and $500,000 is a lot of money. And if you put that on a 10 or 15-year note, you're paying $5,000-$6,000 a month after taxes. So that means you got to make. When we had this conversation, first day of dental school, or first day of clinic anyway, you got to make $10,000 a month just after taxes to meet that obligation, and that's before you put food on the table and a roof over your head. So that's a lot of pressure, and you can fall into the trap where, because you're feeling that pressure, you're not acting in the best interest of the patient always, and unfortunately we see that at times. I always saw it when people came to me for a second opinion, and you're like, they said what and what? I wouldn't say that to the patient, but in my mind I'm thinking, wow. Unfortunately that happens, and I think that happens in every profession, or every trade even. That's why we get second opinions, but I understand that pressure, and so you just have to be really true to yourself. You got to know what your priorities are, and we kind of hit on this at the summit here. Is like, first you got to know yourself, know who you are and what you stand for, what you believe in, and then make the decisions in life based on who you are.
So you have the advantage of seeing, setting all the students off into the wild, and you're the type of person that obviously stays in contact with your students and forms of relationships, these good social relationships with them. And so you've been able to track and kind of see I mean, there's so many options now for a grad. You can do private practice, you know, which is kind of scary coming right out of school just because of the debt load, right?
Yeah.
But you can take an associateship at a private practice or a group practice. You can go corporate. You can go DSO. You know, you can go into education. You can go become a consultant. There's all these avenues now, you know, and I think this is a topic that there's some pretty strong opinions on, as far as, you know, people that don't like, you know, this particular aspect or this avenue for you know, career mode or first job or whatever. I mean, what are you seeing that, I mean, I'm a big believer that, you know, that not everybody's a square hole or a square peg that's going to fit in the square hole, right? And so what are you seeing that or what advice would you give for someone graduating and they're like, geez, you know, hey, Dr. Call, I'm graduating next month. What do you think? I've got this offer at this DSO, I've got this offer at this corporate, and this private practice wants to bring me on an associate.
Yeah.
How do you help students navigate that? I mean, that's a tough question.
That is a tough question, and I wish there was an easy answer for it. And you know, just because of the position I've been in the last several years, I get the opportunity very frequently, especially towards the end of a school year, as students are getting ready to graduate, and they're getting these offers and they're coming forward with these these contracts. They bring them to me, and you know, I help just think them through the process. And I've told students to go work for DSOs. I've told students to go work corporate. I've told students to go private practice. I mean, it's so dependent on what they have in front of them, and it all comes down to what do they want to get out of it. Do they just want a paycheck? Well, it doesn't matter what you do. Find the one that gives you the best paycheck. But if they want to, you know, if they want to grow and develop, maybe someone that's going to offer some mentoring and some coaching and some teaching, that's going to be more beneficial. You know, when they're looking at different opportunities, I always say, are you the first associate that this practice has had? Because, you know, when you're in private practice, you can feel like, oh, there's easily I could support another associate, you know, because I'm so busy, I'm just swamped. And usually that means you have enough to keep a doc busy 1 day a week, not 4 or 5 days a week. And so, you know, I'm always a little leery if it's, and it doesn't really matter whether it's a corporate or private office. If this is the first time they're bringing an associate, I'm like, go ahead and you can do this, but don't plan on it being your only job. You know, look for something else to supplement, because they might grow and they might get there, but they're not there yet.
Right.
You know, it's very rare that you see a single doc be able to keep an associate busy full time right off the bat. So it really kind of just depends. I think, kind of going what we were saying before, you got to understand yourself. You got to understand what your needs are. Like, you should be very clear, like, how much do I have to make to just survive, to put a roof over my head and put food on the table? You know, how much do I need after taxes to be able to do that? And then you look at, you know, the different options you have ahead of you and see which one fits best. I think where I see a lot of our grads, they take a hit a little bit, is when the first one they decide on doesn't work out. And I tell them, hey, look, you're gonna bounce around for your first 2-3 years until you find that right spot. You might bounce around every 6 months or so, and that's okay. It happens. You know, most dentists out there, they're great dentists, but they're horrible business people.
Right.
You know, very few really understand.
There's no training, right?
There's not. When I was in dental school, again, I got a great education, but we had 2 classes. One was how to write an office manual, and one was, I don't even remember.
It was that impactful.
It was that impactful, yeah. He told us we'd be making $40,000 a year. I'm like, wait a minute, the hygienists are making 60. Why am I? It doesn't make sense. Anyway, but you know, that's kind of the education. That was pretty typical. Most dental schools, that's what you got. And so it's okay to bounce around. Just keep looking until you find that spot. Don't put all your eggs in one basket, you know, unless that's a really nice basket.
What are your thoughts on, like, this trend of underserved areas remaining underserved and the metro areas becoming more and more populated with dentists? And you know, certainly we see with, you know, the clients that we have and the people that we work with, that there is a major opportunity if you're willing to do rural, but it seems like why is no one going rural? Why? I mean obviously you may not want to live in, you know, Punxsutawney, Pennsylvania, or whatever it is, you know.
And I think that's it, you know. And that's what I'll tell students. I'm like, hey, if you don't care where you live, look rural, like, because that's where the opportunities right now are. With the influx of corporate dentistry into the practice of dentistry, you know, they're pretty good at identifying metropolitan areas where there's a need and doing the demographic studies, and then they have the capital to get the quick startup, and they jump on those opportunities pretty quick. It's really tough to do like a scratch start in a metropolitan area right now, but out in rural, it's a gold mine. Like, there's lots of places that are very underserved, and sure, you might live a while from wherever you want to live, but shoot, with you know, as successful as you can fly to wherever you want on every weekend and still come out ahead. You know, I mean, yeah, there's downsides to that, I get that, but I started out kind of in a rural-ish in northern Arizona, and I loved it. It was a great place to go.
So what do you want when you have, let's say I'm looking at rural and I find this location, I'm like, shoot, that's good, and I'm, you know, what's your expectation if, you know, because we're talking about debt, we're talking about, you know, making the living off of this, and now you have to have a certain skill set in order to produce, right? So you have, if you're going to be productive and go work, if you're in rural, you know, Arkansas, then you better know how to do a lot of the stuff. So what is your expectation for a graduate coming out of Midwestern? What should they be able to be proficient at the day they graduate? They can walk into a clinic. What should they be able to do? Yeah,
I think, you know, obviously Crown and Bridge, they should be able to handle pretty much anything in that realm. We want them to be able to do simple molar endo and know when to refer and when not to refer. Like my first area I practiced, the closest endodontist initially was like an hour away. You know, closest oral surgeon was an hour away. So I did a lot, and I probably did more than I should have looking back, because I wasn't real good at figuring out where that line was until I got into it. I'm like, oh, maybe this is too hard.
So mentors are nice, right?
That's where mentors were nice.
You need that parachute.
Yeah, exactly. But yeah, we want them to be proficient in simple molar endo, know how to identify complications. We have a pretty good system for helping them evaluate a case to determine the difficulty with, you know, as far as endodontics goes. We want to be very competent in exodontia, surgical extractions, socket preservation, that kind of thing. Simple implant surgery, you know, they should be able to kind of just do the bread and butter stuff. Prosthodontics, you know, removable pros, we want them to be comfortable at least with the process. That's always the hard one, right? I think every school struggles with getting their students enough experience with dentures, and then, you know, that's the first thing when people get out in private practice, we're like, I don't need all those steps in between. And I think we all learn the hard way that, yeah, you actually do need those steps in between. But, you know, we want them to be comfortable at least to go through that process and know how to troubleshoot and things like that.
Right. So what advice would you give for, like, just general advice would you give for a new grad?
I told this probably to you before you graduated, and I told it to pretty much every student I've worked with. I'm like, live like a student for 5 more years until you know you have your income's kind of stable, secure. You know what you're doing. I mean, I get it. You've been struggling through college for 8 years. You want to buy a car. You want to buy a house. You want to do all this stuff. And I'm not saying don't do that, but maybe don't go buy a 5,000 square foot house and, you know, a $150,000 car. Buy a Honda Accord or something like that. You know, you're welcome, Honda.
Yeah.
You know what I mean?
Car for sensible people.
Exactly. But just kind of just take it easy. Be careful about the debt load you bring on. It's pretty easy because you have that degree. People will loan you money, and it's not always a good loan. Just because they'll do it doesn't mean you should. So just be careful about, just like in practice, control your overhead. You know, the more you can keep your home expenses, your personal expenses down and under control, you'll be just in a better place to make good decisions regarding your future going forward. Again, there'll be plenty of time to have all those things that you wanted to have when you chose to go to dental school. And they'll come, but just where I've seen people get in trouble is when they just get overextended. Yeah. And that just puts an incredible amount of pressure on you in practice, and it's just not a fun place to operate from.
And I'm a firm believer that I think that there's a lot of when that pressure comes, I think that that's when those unethical decisions start being made, and it's because you're putting you take an ethical person, a moral person, you shove them in a situation where they're backed up against a wall, and now maybe they start to make decisions that they otherwise wouldn't make because they're desperate, and desperation leads to
exactly.
to
None of
bad
us
decisions.
perform our best when we're under stress.
Right.
And when you have that kind of financial stress hanging over you all the time, it's really tough to always do the right thing. Really tough. So that's my advice. Just relax. Just enjoy the ride.
Settle down.
Be careful. Just be careful about the debt you take on, because you're going to have to take on debt if you want to get into ownership. I mean, if you want to buy a house, whatever it is, and it's not all bad debt. A lot of it's necessary.
Right.
But just be careful about it. Don't be in such a hurry, I guess, would be kind of mine.
Anything else you want to say as this is going out? We've got this. I'm sure this will hit at least 5 or 6 people. So
Again, I'll go back to what I said before. I think dentistry is a fantastic profession. It gives us the ability to literally change people's lives, and when you do that, when you see the impact that you have on people, that's the biggest reward you'll get. The nice thing is it allows us to live a very comfortable lifestyle. I mean, we're here at the Summit, and the location doesn't suck.
No.
And that's because of dentistry. Dentistry allows us to do that. But it also it gives us the means to give back. And that's something I've found a huge amount of satisfaction in. I've been fortunate enough to go on several mission trips around the world, Southeast. We're going to Africa this summer, Southeast or South Pacific, wherever that is down there. A bunch of things like that. But then you can also just do it at home. Sometimes, patient comes in, you can tell there's a need there. There's a dental need, there's a financial need, and you have the ability, and usually your labs will work with you too. And, you can take care of people, and that's the great thing. It gives us that ability to help people that really need it. And so I'd just say the advice, I guess, would be look for ways to give back, because we're lucky to be a part of what we're doing.
No doubt. That's the second time with it. That's twice from very sage people. So, well, cheers, Steve. Appreciate you doing this for us, and we'll get you on again. We'll talk some more shop, and
sounds good.
After you, lose your life to being clinical, Dean, right? All right.
Sounds good.
Well, thank you much.
Thanks.